Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Otitis media is the medical term for an ear infection. It's a common condition, especially in children. Otitis media occurs when the area behind the eardrum, called the middle ear, becomes inflamed. This inflammation is usually caused by a bacterial or viral infection. Ear infections can be painful and cause temporary hearing loss. While most ear infections clear up on their own, some may require medical treatment. Otitis media can help you better manage this condition. There are three main types of otitis media: acute otitis media with effusion, and chronic otitis media with effusion. Acute otitis media is the most common type of ear infection. It's characterized by a sudden onset of symptoms, such as ear pain, fever, and irritability. Otitis media with effusion occurs when fluid builds up in the middle ear without signs of infection. This can cause muffled hearing and a feeling of fullness in the ear. Chronic otitis media with effusion is a persistent buildup of fluid in the middle ear that lasts for weeks or even months. It can lead to hearing problems and speech delays in children. Ear infections are primarily caused by bacteria or viruses that enter the middle ear through the eustachian tube. The eustachian tube is a small passageway that connects the middle ear to the back of the throat. It helps to drain fluid and equalize pressure in the middle ear. In children, the eustachian tube is shorter and more horizontal than in adults, making it easier for germs to travel from the nose and throat to the middle ear. Common cold, flu, and allergies can cause the eustachian tube to swell or become blocked, trapping fluid and creating an environment where bacteria and viruses can thrive. Other factors that can increase the risk of ear infections include exposure to secondhand smoke, attending daycare, and using a pacifier. The signs and symptoms of otitis media can vary depending on the type and severity of the infection. Acute otitis media typically presents with sudden ear pain, especially when lying down. Infants and young children may tug or pull at their ears, cry more than usual, and have difficulty sleeping. Other common symptoms include fever, irritability, fluid draining from the ear, and hearing loss. Otitis media with effusion may not cause any noticeable symptoms in some individuals. When symptoms do occur, they are often mild and include muffled hearing, a feeling of fullness in the ear, and balance problems. Chronic otitis media with effusion can lead to persistent hearing problems, which can affect speech and language development in children. It can also cause behavioral problems due to difficulty hearing. Section 5. Diagnosing an ear infection. Diagnosing otitis media involves a physical examination of the ear using an instrument called an otoscope. This allows the doctor to visualize the eardrum and look for signs of infection, such as redness, bulging, and fluid behind the eardrum. In some cases, the doctor may use a pneumatic otoscope, which blows a puff of air into the ear canal to check the movement of the eardrum. A stiff eardrum can indicate fluid in the middle ear. If the doctor suspects OMI or CUM, a tympanometry test may be performed. This test measures the movement of the eardrum in response to changes in air pressure, providing information about the amount of fluid in the middle ear. Section 6. Treatment options. Treatment for otitis media depends on the type, severity, and duration of the infection. Often, AOM resolves on its own without treatment. Pain relief and observation are recommended. Over-the-counter pain relievers can help reduce pain and fever. Warm compresses provide comfort. Antibiotics may be prescribed if the infection is severe or persistent. Complete the full course of antibiotics as prescribed. For OME and CUM, watchful waiting is often recommended. If fluid persists, a myringotomy may be recommended. This procedure drains fluid and inserts a tympanostomy tube. These tubes ventilate the middle ear and prevent fluid buildup. Section 7. Preventing ear infections. Practice good hygiene. Wash hands frequently. Teach children to cover their mouths when coughing. Avoid secondhand smoke. Vaccinate children. Breastfeed infants. Avoid propping bottles. Conclusion. Otitis media is a very common ear infection that can be painful and affect hearing. Understanding the different types, causes, symptoms, and treatment options can help individuals manage this condition effectively. By By following preventive measures, such as practicing good hygiene, avoiding exposure to secondhand smoke, and ensuring children are up to date on their vaccinations, individuals can take proactive steps to reduce the risk of developing otitis media. UMCC, your ultimate medical consultant connectors.